India scrambles to escape a coronavirus crisis. So far, it's working. Hello everyone, we are trying to take some initiative to spread awareness about virus COVID-19, which is also known as corona. We are making content on coronavirus to spread awareness about this pandemic. Fears are growing about what happens if community transmission takes off in the crowded areas of the world's second most populous nation cities, young people packed into pubs. Despite the Indian government scrambling to lock things down, few on the bar scene were taking the coronavirus very seriously. New Delhi, over the weekend in Lucknow, one of India's bigger cities, young people packed into pubs. Despite the Indian government scrambling to lock things down, few on the bar scene were taking the coronavirus very seriously. Doctors say it is either that there are many more cases in India that have not been detected because of the difficulties of getting tested, or that India has indeed managed to so far escape the worst, possibly because of quick and strict efforts right from the start. India was also one of the first nations to essentially shut its borders, cancelling visas and denying entry to all but a select few foreigners. Some states, such as Kerala, are beginning to beef up internal borders, taking the temperature of passengers in cars and screening people on trains. Still, the containment measures have been imperfect and fear has started to spread. So far, most if not all of India's coronavirus cases have come from travelers. An Italian tour group visiting Rajasthan single-handedly spread many of the cases. But public health experts fear what will happen if community transmission begins to take off, especially in packed urban areas with poor sanitation and where so many people live face to face. The challenge of a large country like India with overcrowding is that some people will always slip the net, wherever you put it, said Dipanjan Roy, an Indian epidemiologist who has worked for the Centers for Disease Control and Prevention, and the World Health Organization. He also worried about what he called the "let's wait till tomorrow" attitude. Indian health officials should have put harsher quarantines into effect in February, he said. That month cost them, Dr. Roy said. But he and other doctors said India offered certain advantages, including a decent track record containing flu epidemics and the fact that India is one of the world's largest producers of generic drugs. Demographics also work to India's advantage. The population here is considerably younger than in the countries worst hit, and younger people have a much better chance of coping with the virus. Another possible factor is that India's weather is warmer, and it is about to get really hot, though that has not been clinically proved to have a major effect. FM Nirmala Sitharaman said her government would soon come out with steps to help industry limit coronavirus impact. After today's 2 new cases, Health Minister Harsh Vardhan also reiterated Modi gov's commitment to countering the emerging threat. But that may not be enough in case of a prolonged siege. Last week, Moody's forecast the virus to put added pressures on Asia growth rates. The impact will be seen primarily in trade and tourism and through supply chain disruptions. India's growth slowed to a near 7-year low of 4.7% in October to December 2019 on continued slump in manufacturing, and now faces the next big challenge of coronavirus outbreak stifling global growth. The business impact of the virus is already being felt in many parts. While the world scrambles to control its spread, the world's most China-reliant economy, Australia, is reeling from shockwaves. The faltering of Australian trade has now fueled questions over whether the nation is too reliant on the Asian behemoth. And the economy of China, the epicenter of the infection, now faces much weaker growth as the spread of the virus has hit both production and exports. Coronavirus has now affected over 118,000 people worldwide, and caused nearly 4,300 deaths, with infections on every continent except Antarctica. According to Nomura economist Sonal Verma, 2 things need to be keenly watched now from India's viewpoint. The segments where India depends on China for imports, like electronics, chemicals, pharmaceutical, solar, are likely to see supply-side shocks, and a negative demand impact could be just a matter of time for India in case the world economy slows down because of China. could turn out to be serious news for India, especially after Moody's has cut its 2020 growth forecast for the country to 5.4% from an earlier estimate of 6.6%, mainly in the wake of increasingly weakening demand. To stay updated about coronavirus, subscribe our channel. Current situation of world coronavirus cases: 664,103. Deaths: 30,883. Recovered: 142,361.